Today, we're talking about cost of care and new regulations that are in effect August 1st. And so our new regulations, actually, before I do that, let me go ahead and introduce our panelists. So let me pop that out. And I just wanted to let you know that we do have from our Division of Healthcare Services, we have Jana Atonio. We have from DPA, Division of Public Assistance, we have Christina Davis, and I believe we have Marianne West. From Senior Disability Services, we have Maureen Harwood from our leadership team and our training team, which is Cassandra Lynch, Sina Fisher, Delight Mells, and myself, Kara Thrasher Livingston. So I also want to thank all of our panelists too for helping to collaborate on the content of the material as well, especially our partners at Division of Public Assistance, Division of Healthcare Services, and Conduent. If we get a chance to answer all your questions today, great. If we cannot get to all of them, sometimes that does happen. We're willing to put together maybe a simple FAQ for people or otherwise interact with you at a later date or in a different way to get the information out to you that you need. All right. Thanks again, everybody. Okay, so what is cost of care? We have new regulations. Cost of care is a state regulation, but also informed by federal regulation. Federal regulations and state regulations work together to require that the state of Alaska reduces Medicaid reimbursement to a provider by the amount of the person's cost of care, even if the person does not pay the cost of care to the provider. So the federal regulation looks like this. It is informing the structure of home and community-based waiver cost of care structure so that a person who has an income which is over their Medicaid limit determined in legislation for personal needs allowance would need to pay that in cost of care as a copay to the waiver provider. And this particular regulation is the state regulation, which states that the person's cost of care liability is collected by the provider. And this is specifically to our home and community-based waiver services provider, but it also addresses the long-term care facility and assisted living home. But today, our audience, of course, is intended to be our home and community-based waiver providers. So we'll stick with that in our focus, the home and community-based waiver provider. So here it states that we're providing services as a residential provider or other waiver provider. The provider will collect from the recipient or the representative on their behalf the amount determined to be the cost of care liability, which is determined through Division of Public Assistance. And the payment in reimbursement to the waiver provider would be reduced by the amount of the cost of care that the recipient pays. And so their total reimbursement is the same. It's just that the person has made a contribution in their cost of care. The new regulation, effective August 1, has that our certified and enrolled waiver providers of out-of-home residential supported living, group home, and family rehabilitation services collect the cost of care amount, which we call COCA, C-O-C-A, from the person. Medicaid reimbursement is reduced by the cost of care amount. And this occurs whether the person, the resident, pays the COCA to the provider or not. Other waiver services, meaning other than out-of-home residential, to include services like care coordination, respite, in-home supports, day hab, supported living, meals, waiver transportation, and the rest. The provider can collect the cost of care amount from the resident and report to their Medicaid billing. Medicaid reimbursement reduces is reduced by the cost of care amount. And the individual can choose which provider to pay after paying the residential provider should they have one. Cost of care is interesting because it is not paid to Medicaid service for Medicaid services or procedures or items outside of waiver providers. We do get this question quite a bit. It's not going to be for eyeglasses, a medication, medical equipment, any item, service, or procedure that regular Medicaid covers or doesn't cover, an individual caregiver or family member, and in addition to, it doesn't pay in addition to Medicaid waiver service reimbursement. So what is cost of care exactly? Cost of care, excuse me, just one second. Cost of care is illustrated as such. It is where DPA monitors a person's benefits and monthly income and expenses. So this is what they report to Division of Public Assistance. And so there may be cases when a waiver recipient's income is temporarily above the limit, or more than just kind of temporary. It could occur for several months at a time, when the person's income is temporarily above the limit for Medicaid. And so that additional income causes the cost of care. And that is how it's calculated basically. Now, I don't have all the ins and outs of DPA here, but that is the basics of how the income is counted for by DPA to produce the result of the cost of care amount. Okay, next slide says a cost of care is their copay. They pay the amount that's over in their monthly income to the waiver recipient. I'm sorry, to the waiver service provider from the recipient, and the provider reports that on their billing, and when they receive their reimbursement, it pays the difference. So how is cost of care calculated? There are certain kinds of income that a person receives when they have these benefits that do not count. The personal needs allowance, which is a set amount determined in legislature, and things like uncovered medical expenses, if they have those, insurance premiums they may pay, spousal dependent allowance, and things like that. Again, this is not a complete list. This is the art and science of Division of Public Assistance and what they do to help calculate cost of care if the person has a cost of care due. So the personal needs allowance is the amount set in legislation. So the law states that their personal needs allowance, if a person is living in their own community home, their monthly income personal needs allowance is $1,696 a month, and living in an assisted living home getting waiver residential services, personal needs allowance is $1,396 a month. All right, so I am going to hold on that for just one second and just kind of recheck my questions area here. Again, please feel free to go ahead and put in your questions as we go, and we'll do our best to get to them as we get further along. Okay, just want to make sure that that you're feeling like you can interact and going ahead and doing that. Okay, awesome, good job. Okay, so a personal needs allowance in terms of factoring it for cost of care. Again, it is the maximum amount in legislation that's to be used for personal needs. Here's a look at the regulation, okay? The wording of it and the number of it. The note to myself here is the person living in their own home is 1656. Okay, cool. Again, not all, I wanted to put the slide in so that I know that not all are, remember to say that not all recipients receive as much as the total personal needs allowance. It really depends on the person's benefits income. A lot of it has to do with their work history sometimes and Social Security benefits sometimes. So just know what a personal needs allowance is, and that you may be serving some people who don't receive that much in their total income per month, just the limit. Okay. Living at home, receiving home and community-based waiver services, $1,656 a month, and living in the ALH, receiving home and community-based services is $1,396 a month. Again, not everybody gets the entire amount, receives that because of their benefit structure. So a personal needs allowance, and this was interesting, which I learned from my collaborators with the Division of Public Assistance, and it's also in regulation too. An individual's personal needs allowance can be increased to cover mandatory taxes, garnished child support, or income needed to fulfill a plan for achieving self-support, which they call a PASS, and certain guardian conservator fees. Again, Division of Public Assistance determines that COCA, it may be potentially reduced by these common allowances: community spouse, family member allowance, insurance premium allowance, unpaid medical expense allowance, and home maintenance allowance. So the person needs to report these circumstances to their DPA caseworker so DPA can work on possibly reducing the cost of care. And if the person feels they need to have a higher personal needs allowance, then they can work with their caseworker about that too. So how does a person know if they have a cost of care amount, a COCA? Division of Healthcare Services will send them a letter which explains the cost of care amount due and instructions when it's due and all that good information. If they are living in out-of-home residential, the residential home office will get a copy and the care coordinator will get a copy. The letter includes a worksheet to help the person identify which providers they'd like to pay, past the residential provider, or if they don't have a residential provider. And it has instructions to return the worksheet to Division of Healthcare Services with their choices. If the person does not pay their cost of care amount, they receive a second notice and a third notice about that. We do get a lot of questions about personal needs amount allowance. If the person believes that they may qualify for an increase, they should definitely contact their DPA caseworker. Or if they have any of the other allowances in their life, or if they just have a question about it, they should contact their DPA caseworker. If they do have a cost of care that's higher than the service reimburses, or they don't have money to pay the cost of care, they should contact their DPA caseworker. And the cost of care amount is determined from the total cost of the support plan. This is interesting for our care coordinators. If a person does have a high cost of care, it may work to analyze and amend their support plan to reduce the cost of the plan. In other words, to ask for services the person will use and has been able to use. And so I get that we do have a COVID history here where people were unable to use services because of COVID circumstances, everything from the person's circumstances to staffing and things like that. So outside of that, it might be a strategy to amend the plan to reduce the services in the plan if the person has a high cost of care. Not in all cases, but it might be a good thing to think about and to work with the person and DPA about. So how else can a care coordinator help? They can help the person stay informed. They can contact DPA by phone, email, and in writing or in person to let DPA know that you are the person's care coordinator. Mostly in the instances and questions that I've had about how do I contact DPA on behalf of a person, it really is just a matter of the DPA doesn't know that that's the care coordinator because they do change, from time to time. So if DPA is unaware that you're the care coordinator and you do not have a release of information on file with DPA, then it's going to be really hard, it's not going to happen that you're going to connect with DPA. So the best thing that you could do is just make sure that they do know that you are the care coordinator and that you do have an ROI on file. You could certainly send an email about the care coordinator change or update to the address that you see here, dpa-longtermcare.office@alaska.gov, or you can call the 800 number, 1-800-478-7778. For release of information, best, most current info is to please submit the Gen 58, only filling out the lower half. We do have a look at that form here in just a minute. Fill out the lower half only and send it to the same email address, and you do not have a need to use DSM for that. So care coordinators, this is a Gen 58. We can send you a copy of it, or actually I think I put one in the handouts. If not, we can get you a copy of it. Just the lower half, not the top, not the upper half. Oops, just the lower half. Go back to that. Okay, permission to release information. And thank you. It is also posted online, so you can get a copy there. Okay, Gen 58, lower half. So I wanted to quickly look at the letters in the worksheet. I want to take too much more time here. I do want to get to your questions. Letters quickly look like this. We're going to get there. All right. This would be your first notice here, a person, just an example. You've been approved for long-term care Medicaid, and you have a cost of care. So this is just an example of the cost of care letter the person would get. Mail you a notice of the amount. If it changes, we'll mail you a notice of a new amount. It's the amount that you must pay to the providers identified in your cost of care agreement form. That would be their residential provider first, and if they don't have one, that would be others that they pick. It explains what COCA is for the person, how it is determined, which we pretty much just went over. It says, which providers do I pay? It talks about a little bit about the plan of care support plan, and being somebody who's the care coordinator refers to the care coordinator. There's an agreement form for you to complete, it says, and you pay each month to your provider that you put on the form. Residential, you have to pay those first. Who pays the COCA? You, meaning the recipient, your designated power of attorney, legal rep, or trustee of a qualified income trust established on your behalf, pays the providers directly for services received through cost of care. When do you pay the cost of care? It's going to be by the 10th day of the month, or no later than 10 days after services have started, if that applies to their situation. Providers collect the cost of care, and then just I think the next page just has the signature and the person who sent it. And it's an example. Second notice, if they are not paying their cost of care, they receive a second notice. And it restates the cost of care amount and the same instructions. If you have questions, who to go to, right? I'm not going to go over that whole one. And then here's just a quick look at the third one. They do get a third letter, a third notice, which asks for their response and asks that they pay, tells that they pay. Okay. And I think at the end here, I do have the worksheet. Again, you can download this from the handouts, or we could send you this. Okay, so I've been told that the address on this payment agreement needs to be revised, so please just treat this like a learning object. The person would have a payment agreement sent to them, they would fill it out, and this is where they would tell Division of Healthcare Services who they're going to pay. Okay, so they would choose the provider, residential first if they have residential, out-of-home residential services, sign it, and return it. Okay, so they have a different office address now. Again, this is a learning object, but that's the idea of it. Okay, so I just wanted to make sure that you knew that that this is the intent of it. Okay, So I'm going to open my questions pane here. First, before I go to my first selection of Q&A that we had submitted ahead, I wanted to ask my panelists if you have anything to add. Was there anything that you wanted to say at this time? Go ahead and just jump on in. Anything to add, panelists? If not, it's okay too. You can unmute yourself and join in. The webinar will be recorded and we'll post it on our YouTube channel. Okay? Okay. Awesome. So my next slide has our previously submitted questions, and I wanted to go ahead and display that and let our panelists unmute and answer. And just give me 1 second, I'll get it up on our screen. Just a few here, and I'll make them a little bit bigger, and I can read them out too. So, and we'll do our best to get to your other questions that you have, of course, submitted during the webinar session as well. So I just wanted to encourage you to go ahead and write in your questions, even if you think it's been answered before. It's good for us to know how many people have questions and what the nature of those questions are. It's all good info. And that also gives us a chance to interact with you again to offer you answers to your questions in whatever format seems right. If it's an FAQ or just an email to you or something like that, you know, we'll take a look at what they are and see what we can do about getting you good information. Okay, so first question here says, how does a waiver provider, both residential and non-residential, know if a person owes a cost of care so the provider can collect it? Yeah, is there, go ahead. Marianne, are you there?
Yeah, sorry, I was trying to read the question again. So the waiver provider can.
How do they know, a residential or non-residential waiver provider, how do they know if a person owes a cost of care so they can collect it? What's the best way?
Well, they can contact DPA and the client should tell them. Okay. Also.
Awesome. Okay. The next one I found was answered by the letter. So I just wanted to read it out. When is cost of care due to the provider? According to the letter, the person must pay within the first 10 days of the month or the first 10 days after the service started. So that's a good one. How does a provider know when the cost of care amount changes or ends?
Again, the client should be telling them with the letter that they receive. And also, like nursing homes, we send letters to them, so they should get a letter themselves. And they can also contact DPA.
Okay, thank you. What's a good way for providers to document that they've collected cost of care for their audits?
That I don't know.
Any thoughts? Anybody? I have a suggestion. I've had this question before. This is Kara. I just turned off my camera because it's going to be other people, you know, talking here for a bit. In this question, my best thought here is that if we ask the person to pay make a separate payment, like write a separate check that says cost of care on it, then you have a check, you know, a payment that's specifically for cost of care, and you can keep record of it like that. You can keep a copy of their payment like that. Now, I did get other questions about billing, providers' internal billing software and things like that. I'm not, unfortunately, I'm unable to answer those. It's really up to the provider how they want to log that. As long as they keep separate records, and my best thought is for the cost of care, my best thought is to ask the person to just write a separate check. Best answer right now. Anything to add? Anybody?
That
Okay.
sounds reasonable.
Yeah. Okay. So what happens if the recipient does not pay the provider?
The provider can stop services. If the client has a trust, we can close the waiver case down if they're not paying with the trust. Only a trust, though.
Okay. Good to know. Anything else to add? Anybody or? Jana, Christina, anything to add?
I think Mary pretty much said it already, but we are not allowed to close a Medicaid case for failure to pay cost of care unless there's a trust involved. So the important thing for people to remember is if they're not getting that cost of care payment from the client, that the only thing they can do is stop services. Otherwise, they're just going to get paid, less than if they receive the cost of care.
Gotcha. Thanks for all the clarification. Okay, so how can a care coordinator be sure to get a copy of the recipient's letter of COCA obligation? My best answer to that would be, as we've presented, to make sure that you're the care coordinator of record with DPA, and that you have a Gen 58 with the lower half filled out on file with DPA for your person. Anything to add to that? We're okay. Get it, got it, good. Thank you. How can care coordinators help a client experiencing cognitive issues understand and pay their cost of care amount? My best thought here, I get the question a lot. It's interesting because people, I'll put on my camera, people are participating in the whole story. And part of it is their financial eligibility for Medicaid and eligibility for services and things like that. So my best thought here is that, we should really work directly with that person to help them understand the best we can. I know some people will not. Usually when somebody doesn't understand, it's best to find a loved one, or if they have a legal representative, of course, or maybe they are not to that place in their life where they have somebody who acts on their behalf. And there's a spectrum of that too. But just try to find somebody who can help you get these concepts across to the person. We do a lot of plain language, and we do a lot of, coaching of that in our skills of interaction that we try to teach and share with our care coordinators. I would invite people or care coordinator who, if you have troubles like this, to just please come to our office hours or make an appointment with me, and we could talk through how to maybe help that person understand a little better, without losing their ability to direct their own money. Again, for people who don't have that ability or become, where in situations where adult protective services could help, if a person is creating health and safety issues because they can't pay, and they're getting dropped from services because they're not paying. I can't come up with every single scenario off the top of my head, but Adult Protective Services is there to help too, in case somebody needed some help with understanding or help with paying in terms of direction, or some kind of somebody working in an assistive role for that. So I'm not saying that it's a case where every single thing gets reported, but I'm not here to also teach separately about reporting. If a person, has conditions where you need to report, then of course do so. So, all those things kind of go in a string for me. They go into like kind of one story for me. That's why I'm mentioning it. Anyway, my best answer for that. How can care coordinators help a client choose which provider to pay? Again, I do have a suggestion for that. We do teach this. We have taught this throughout the years. They should choose the waiver provider who provides the bulk of the service, the largest amount. Yeah, and thank you. My team is advising me to what about setting up or presenting it like all people pay bills and this is a bill. It's a cost of care copay. It's a Medicaid. Like an insurance copay. I know you've heard of those things. It's pretty easy to help people understand once you break it down into step by step. We do want people to have control over all aspects of their lives with assistance. So absolutely. And then the last one here, again, how to help a person choose. So we just say in our training, our best answer has been, to go with the provider who provides the bulk of the services. But any other waiver provider can accept cost of care, including care coordinator, or does accept it. So, okay. I am going to go back to my questions here, the ones that you all have sent in to us or submitted during our session. And I think I'm going to go back to the previous slide that said questions on it, just to be plain, if we're talking about questions. All right, panelists, what I'm going to do is read out questions here. Our learner community here, please know that I may summarize them. If I don't read your question out word for word, it may be because many of us are asking that. Don't worry, all of your questions come to us in a fashion that we can record them and we can work on them to provide additional information should that be necessary. And that's the way we've worked for a long time. And we will post a recording on our YouTube channel. So I am currently scrolling up to our questions and where they started. Thank you, training team, for helping to qualify some of these for me. And we'll just go for it. Typically what we do here is I'll just read them out and our panelists just jump in and answer as you can. All right. So there were a couple of questions about what if the cost of the COCA is higher than their claims billing. That is definitely, they should be talking with their DPA technician about that.
And this is Maureen. I was wondering, Christina or Jana or anyone, if you had any comments on that, because we get that comment a lot. And I was curious, should people be seeing that? And what are your thoughts on that?
Hi, this is Christina, and I'll let anybody else follow up if they have anything to add to what I say, but you shouldn't have a circumstance where the cost of care is higher than the services. If ever that is occurring, there's something going on that needs to be brought to our attention. Did anybody else have anything they wanted to add?
Thank you, Christina, because we get that a lot. And so it was really good to hear you say that. And we just want to remind folks that's not something for SDS to answer, and we can't figure that out with you. So it's really your partners at DPA and healthcare services. So use them as your conduit, so to speak.
Absolutely. Thank you. Okay, so next question, I'll read it and then I'll read my answer. You can correct me if I'm wrong. it says, how does DPA decide which provider's payment will be reduced by the client's cost of care? So my best answer on that is it is the residential provider if the person has a residential provider. If they do not have a residential provider, it is the one or ones that the client chooses on their form. Anything to add to that? Okay, go ahead. No, okay. Next question says, this is an interesting question. We usually do get this kind of question here. I'll do my best to answer it fast. It says, do we still have to deduct $100 out of $1396? Okay, so this question is in the world of assisted living. There's a regulation in assisted living regs that says that, and this is opening up a whole nother book of regs. Okay, so I'm taking a book off a shelf and I'm opening up a whole nother book of regs. The assisted living regulation says that the person can allow the home to manage up to $100 of their money. And it doesn't say that the home does anything like deducting $100 or any of those things. The personal needs allowance I'm talking about is not that. Okay, the personal needs would be the 1396 determined in regulation. And so the question pertains to, you know, charging what to charge for room and board and deducting $100. It really is just a matter of the person can allow the home to manage up to $100 of their money if they choose to do so. And the home needs to keep it in a separate account and things like that. So there's a couple of different layers around that answer, but it is an entirely different book of regs. 1396 is personal needs allowance to determine COCA amounts and everything else in the structure in the world of DPA and eligibility. Okay. What if a client doesn't live in an ALH, but their cost of care is greater than the amount a care coordinator bills and they don't have any other waiver services? How does cost of care get paid? That would be where they would talk with their caseworker in order to make sure that their information is correct and that their cost of care is determined correctly, and if there's anything else that needs to be done.
Yeah, and this is Maureen again. That question you heard Christina, that's a question that really has to go. You should be, you know, advocating fiercely for that individual to have them contact with you, the DPA or help.
Yes, thank you. I'm looking at my list here. Lots of questions about how to tell what the cost of care amount is. Is there a place listed with health enterprises that tells the amount of the cost of care? This would be a question for our conduit and conduit partner, and unfortunately she had a conflicting meeting, so she's not here. So Marilee Reinhardt Davio with Conduit Training is a great partner of ours, and so I will get with her about that. We did have questions about people being able to, providers being able to look up cost of care in enterprise. So I will get with her about clarifying that information for our providers. I believe there is a place that you can look in health enterprises where it's listed as far as where and how. I don't have the capacity to teach that right now today, but I realize of the need for it. Okay, question says, will recipients be notified only after August 1st? I'm just wondering how many of my folks will be affected. Panelists, how do people know about this change? And when do they know?
If the cost of care is changing, then they should get a notice. I don't know what change you're talking about August 1st.
I think it's the change in the reg is what we're.
That's when they're changing the regs. But we send notices, the Division of Public Assistance sends notices with any kind of a change in cost of care amount. So they're going to get notices. Whether or not copies go to other people depends on the living arrangement and releases of information that we have.
Mm-hmm. Okay, we have a lot of care coordinators with us here today. If a person wanted to pay their care coordinator, a care coordinator does not bill for their monthly services until after the 10th of the month. So how would that work best if they were going to pay a care coordinator the cost of care in terms of, being timely with their cost of care payment versus the care coordinator billing for their services after that month? Any thoughts on that?
And this is Maureen. I don't know, Marianne or Christina, if anyone, if it would be helpful if we wrote that one out for you. So they're just saying it's on a little different billing cycle. I don't know if you have any answer right now, or do you want to hold that question?
And we can discuss that later if there's, would take a lot of time right now. And Maureen's right, it's just a different billing cycle. That's all. Okay, well, thanks for the question. Good question. We'll look into it. Okay. There's a few questions about, does the provider have to reduce the amount that they bill for a service for that client by the cost of care amount, or will it be automatically deducted? So my best answer is that you, as a residential provider, I'll let my panelists ask. For when a provider goes to bill, is it automatically deducted, or do they have to deduct it by reporting it on their billing? Okay, the answer here is they have to report the cost of care amount on their billing. Okay, so there's a question that says, since cost of care was put on hold for COVID-19, does that mean that August 1st is the date it will resume? Is there a COVID hold on it still, or go ahead?
Yeah, this is Christina, and unless it changes right now, we've been told that it will not change until the end of the public health emergency, and that's in control by the federal government. So at this point, that is the expectation, that it might be on hold through potentially the entirety of 2021.
Okay. Okay. Thank you. So the next question says, how often should a person update their agreement of their cost of care, who they agree to pay? How often is that updated, or should it be updated?
To be updated if they have a change. They wouldn't have to do it every month.
Okay. So does a provider get a copy of the form indicating a person should be receiving the cost of care amount or collecting the cost of care amount? So my best understanding of getting a copy of cost of care amount due would be the residential provider gets a copy of that if they have a residential provider, and the care coordinator gets a copy of that. So again, my best understanding, and panelists jump in and correct me or add, is that we should connect with the person to see if they have a cost of care. Like a provider could ask the person if they have a cost of care. The person can notice the provider. Is that correct? Okay, I don't hear any objections, so I think it's correct. The care coordinator does get a copy of the letter. Again, they have to make sure that DPA knows they're the care coordinator in order to get that letter, and they have the Gen 58 lower half filled out. So the care coordinator can help providers understand as well about cost of care. The person can also help. If the person is not a reliable resource, then the care coordinator can help the team understand that. And so part of care coordination is to work with providers about the quality of the service, of course, but this could be something that a care coordinator could help a provider know about as well. DPA sends the letter to the assisted living home with the waiver services if the person has a waiver service out of home residential, and they send it to the care coordinator. And of course, they send the letter to the person and their legal representative. Question: if the client transfers care coordinators, does the new care coordinator receive notice of cost of care for the new client? They do if they let DPA know that they are the new care coordinator and present them with the lower half of the Gen 58. Clients don't tell us about cost of care. Again, the importance of, as the care coordinator, getting making sure that you get a copy of that letter.
And it might be, this is Maureen, helpful. I mean, to add this to your bag of tricks or toolkit, to always say, have you ever heard of cost of care? Or did you get a funny letter from DPA? And not funny like haha, but you might add it to your list of questions you just consistently ask people, and they may not know. And then that's a good place to go back to DPA to say, hey, it seems like this person might have a cost of care. And once Kara shows people where they can look it up too, but in the way of keeping the person center, it's always, good chance to teach them, oh, this might be something you do have and you don't know about. So that's my suggestion. I don't know if Christina, Marianne, or anybody else has a suggestion that you would offer to people.
Mm-hmm.
If the client is receiving APA cash, then they wouldn't have cost of care. If the client is not receiving APA cash and they're on waiver, it's a good chance they do have cost of care.
Okay, this is Kara. We're still here. We're closing in on our last 5 minutes. Lots of questions here at the end towards what to do if a person does not pay their cost of care. Some of the discussion here or suggestions have been to fill out a critical incident report if they do not pay their cost of care. Again, I'm not going to say that we can't fill out a critical incident report. I think that if a person's not paying cost of care means that they move towards either evicting a person or stopping services because of that, and that translates to a danger to health and safety, a loss of the benefit of that service, then it could become a critical incident report. I know everybody wants the black and white answer, of course, but I don't discourage people from filling them out if that seems to be where it's adding up to, or that's you want to cover your bases and you want to fill out the reports about health and safety, and you're an obligated reporter, so that could be part of it. So a few care coordinators said they have sent other types of releases of information rather than the Gen 58. In researching this with our wonderful collaborator team members, I've learned that the Gen 58 is what you want to send. So if you need to send one, send one. If you're already communicating with DPA because you send a different one, I would say don't do that unless you're asked to do so. For an ALH, there's a comment that says the issue a 30-day notice for eviction and remember that the Landlord-Tenant Act is in effect. Great comment, thank you. Appreciate that. Other thoughts of it might be seen as a conflict of interest for care coordinators to get involved with finances if a cost of care is going to a care coordinator. Yeah, we do talk about that. We don't encourage a care coordinator to give advice or direction on finances. We encourage them to give resources so the person can make informed choices. And as far as being a provider, I have to pay a copay to my medical provider who provides services to me anyway. So I know everybody, we get a lot of, feedback about medical model and things like that, but it is at the end of the day medical insurance. So it could be also determined a fee for service. Okay, a provider notification. I'm not sure exactly what the question is. It says answer the question about provider notification. Providers who are operating assisted living homes, they get a notice of cost of care due from DPA, a copy of the one that is sent to the person. A care coordinator also gets a copy. Nursing homes, same thing. The way to know about cost of care due is to check with the person, make sure DPA has your address on file, has your correct information on file, release of information, check with the care coordinator as well. And then a little bit of an unknown part for me is how to look in Conduent, but I have a note about that too. So other questions, if just the last minute here, last minute questions. If COVID has stopped COCA payments, does that mean that they don't have to pay? That's one question. And then the other one is, what if a person didn't get services because of COVID and they paid their cost of care? Do they get it back? So those final two. Panelists, any thoughts on those?
So this is Maureen, and those are great questions. And unless Christina has an answer right this minute, that might be one we take and issue something. But Christina, I hate to put you on the spot, but I'm going to, any answer to that at your fingertips, or should we take that one and let us issue an answer?
Yeah, I'm sorry, I have to leave for another meeting. I'm running late for now, but I think that's a good one to pull back and double check, because my understanding is that they aren't collecting any cost of care right now. So we can do a little bit of digging.
Okay, sounds good. All right, well, that sounds awesome. It is at the top of the hour. I know everybody's busy, so go ahead and close our session. But I really want to thank everybody for coming.